thanks for joining me. I'm Shannon Coffey, RN, BSN, and current DNP student at Gonzaga University. And today I want to share with you my proposed policy for the revised hospital readmission reduction program. In the finalized hospital readmission reduction program under the Affordable Care Act, Centers for Medicare and Medicaid Services established a risk adjustment ratio. This formula is used to calculate readmission payment adjustments made to hospitals to reduce Medicare spending and provide an incentive to hospitals to work to reduce hospital readmissions. While this current risk adjustment ratio does adjust for factors such as age, comorbidities, and patient frailty, it does not take into account socioeconomic factors such as education level, income, language barriers, place of residency, and place of birth, all of which have a direct effect on an individual's overall health status and a direct effect on an individual's risk for rehospitalization. In 2015, 43.1 million Americans were classified as being at or below the poverty level. According to the CDC, educational attainment and income status are the indicators that are most commonly used to measure the effect of socioeconomic position on health in the United States. Hospitals in lower socioeconomic areas and who cater to disadvantaged populations are at a huge disadvantage and are the hospitals that are taking the largest financial hit with the current program. This is where my proposed policy comes into play. My proposed policy is to revise the hospital readmission reduction program to include socioeconomic factors, education level, and income into the current risk adjustment formula that is currently being used. My revision to the risk adjustment ratio would allow hospitals that cater to low socioeconomic populations have payment breaks on the reduced payments made from Medicare, as their patient population would be better accounted for in the risk adjustment ratio. In my proposed policy, hospitals in higher socioeconomic areas would most likely see no changes to their Medicare payments, but would also not be penalized due to serving their higher socioeconomic patient population. My proposed policy will not cost Congress or taxpayers any money or funding. It simply adjusts the current risk adjustment rate formula that is currently in place. My proposed policy would continue our government's and nation's goals of reducing unnecessary healthcare costs and spending, and would continue to save on Medicare dollars spent, and would continue to build upon the Affordable Care Act's overarching goals of expanding healthcare availability, access, and coverage for all Americans. With the large health disparities and growing gaps in overall health wellness within our population, I urge each of you to consider my revised hospital readmission reduction program to better serve our population and reduce health disparities in our nation. Thank you.